Hi guys, welcome back to my YouTube channel, Adventures in Infertility with Keisha. Sorry I look so rough today. It's just literally one of those days today. So, yeah. But this is supposed to be like real, raw, and uncut. So, yeah, some days y'all gonna see me on here with just a skull cap on or a bonnet or something. So, anyways, wanted to do a recap of my last video. Well, not a recap, but just pick up where I left off and kind of go over some other things today. So we left off with my first video as far as going over my conditions and stuff like PCOS, endometriosis, adenomyosis, and I kind of explained those to you guys. And last time we left off, I was having a flare-up with the adenomyosis. So, it got worse before it got better. So my doctor had to prescribe me, like a low-dose birth control, to kind of contain the bleeding. It didn't work. So it got worse to the point where I had to be, and this is within like the last week or two, where I had to be placed on bed rest. So bed rest, well, with the, they took me off the birth control and then they put me back on. But I've never been a fan of bed rest, but it actually really does work. And it worked in this case, with the combination of the birth control, and we were able to get the bleeding contained, and we're okay now. So I am scheduled for my HSG ultrasound on Wednesday. And just to recap a little bit of what that is basically where they they conduct like how a pap smear is done, but there is a small catheter that goes into your fallopian tubes, and then there is a dye that is released into your fallopian tubes, and it tells you whether the tubes are blocked. They can just have a better look at the uterus, looking for like polyps. They probably can have, a better grip on the whole retroverted uterus thing, like I explained, me having like a tilted cervix and not being able to find things and stuff. So they'll have a better look on that, and as far as me moving along in IVF. So got that under control, and due to the problems that I do have with my cervix, I'm actually going to be placed under sedation for this. So, I don't have to worry about being in excruciating pain and stuff. And they can do a little bit more of whatever they need to do. So, got that under control. So, still taking the low-dose birth control. And just from doing my research on it, it's more of a lot of estrogen. Then I don't think this is like a normal birth control. I think it's a different type of birth control versus somebody that's taking it just not to get pregnant. Because it definitely does cause a lot of side effects. So like I told you guys in my last video, a lot of these hormones that they give you for IVF, is a lot on our bodies. And being on this whole whatever this stuff is, as far as birth control or whatever, it has been rough. This stuff gives me extremely bad mood swings, just tiredness all the time, and, literally just be wanting to sleep all day. But I have to go to work. So yeah, it does make it hard to be at work and have to deal with the public, and then have to deal with employees and stuff. And, I have a million and one things going on with my body right now. So, it's definitely been a challenge for me controlling my emotions and, you know, just trying to get through the process as best way as I can. For many of you that know me personally, you know, Keisha has a bit of a temper. So imagine that being combined with hormones. So yeah, I don't have the best days sometimes. And you know, it's just a lot trying to deal with that. Hopefully after this procedure on Wednesday, I'm praying that I can come off of this, because I don't know, this stuff is from the devil. Like, yeah, it definitely makes you feel like you're not yourself. So, you know, got that schedule taken care of. And then I also had to go consult with the OBGYN to do something called a urosplasia. So basically, it's like a regular pap smear. And this doctor, I actually liked him because due to, you know, I did forewarn him of my cervix issues and stuff like that. So, you know, he was used to dealing with people that had those type of conditions. And I was actually able to get through an actual exam. Yes, it was painful, but, you know, I was able to take deep breaths and, you know, just get through the process. So, for those of you that are not familiar with your cervical urplasia, basically it's just testing for abnormal bacteria in the uterus. So it's basically just a swab, and then they send it off to a lab, but the swab has to go into the cervix. So he was able to find that, you know, after a little while. So that came back positive. So basically, you know, he was just like, it's a normal thing, you know, for people with your condition, as far as bleeding all the time, you know, to have abnormal bacteria in the cervix or the uterus. So basically, they just place you, you know, on antibiotics and stuff for like a week, and then they come back and test and make sure it's gone. You definitely don't want to have abnormal bacteria in your uterus when you're pregnant or trying to get pregnant, because they definitely can cause miscarriages. It definitely can cause preterm birth, so, you know, the baby not staying in your full term. It can cause, you know, your baby to be delivered early than expected. I've even read that it can cause, you know, sometimes for, you know, the baby to be delivered and then the baby is sick all the time, or has, you know, some type of deformities and stuff like that. So they definitely, you know, want to make sure that that's taken care of before I even move into the whole IVF phase. So it, like I said in my last video, it's a lot to work up. As far as, you know, especially someone that has a lot of issues and stuff, as far as health wise and stuff, it's definitely a lot of workup to get to the actual IVF procedure, which is, you know, retrieving the you know, making sure your hormones are in place first off, then the retrieval of your eggs, and then those eggs being placed with the sperm to make an embryo, and then that embryo being inserted back into you. So another thing that I kind of wanted to touch on, you know, since this is something that's coming from me and I want people to be able to relate to this, and I'm pretty sure there are thousands of women out there going through my same position. A lot of them are married, and, you know, like I said, this is not something easy to go through. And, you know, like I mentioned earlier, with the hormones and stuff, and, you know, the mood swings and stuff, and, you know, IVF is really tough on relationships. And I'm not even going to just speak on marriages. You know, that you have people that don't desire to get married, but, you know, you and your partner want to just have a baby, and that's perfectly okay. you know, and then you have same-sex couples that, you know, are going through the same thing. More so with women, you know, if, you know, you have same-sex couples that are women that want to have babies, and they can choose to go through IVF. They would just have to use, obviously, they would have to use donor sperm. So any relationship that's going through, you know, having a child, and it not, you know, you're not having it naturally, you have to go through, you know, operations and stuff to have it. It definitely puts a strain on your relationship. And, you know, from my own personal experience with this, women and men take things very differently. You always are going to have that, you always are going to have one person that's more dedicated than the other person. And typically, I've seen it to be women. You know, we're the ones carrying the child. We're the ones that have to go through all this medication and stuff. So our bodies are a lot more affected than men. Men more so deal with the psychological aspect of it as like, oh, you know, this is not happening naturally or something like that. So they more so deal with, you know, being angry and, you know, like, you know, is it me? Or if it's not me, then, you know, I don't understand why this can't happen like normal people do. And they don't necessarily go through the physical stuff like we do. So it's always going to be one person that takes it more seriously than the other person. Like I said, it's typically the woman that takes it more seriously. And that can definitely cause a rift in any relationship. I feel like in my own personal life, I do take it more seriously than my husband does. You know, just putting it out there, I've wanted to be a mother since I was like 15. I know many of you like, oh my God, that's really young. But, you know, I've just always felt a strong desire to be a mother. And in this situation, you know, I want this more than my husband necessarily wants it. He's more patient than me. He's more, you know, if this is what we got to go through, this is what we got to go through. And, you know, let's just be patient. Let's just see how it works out. But, you know, men don't typically understand medical things like women do. Like in my case, you know, I have adenomyosis. That gets worse over time. And every time I go into these long bleeds and stuff, that damages my uterus even more. So, you know, dealing with the doctors and stuff, I have a specific time frame. So, you know, I just feel like, you know, if you're going to be all in, you have to be all in. And at this point, you know, there's no room for mistakes. There's no room for setbacks. You know, this is a timed thing. And, you know, like I said, going through the bleeds and stuff, it just gets worse and worse and worse over time. And eventually we'll get to the point where it's like, okay, well, we can't do the IVF. You need to have a hysterectomy, which has already been brought up several times. So, you know, that's kind of why I'm in the urgency to get this done. So, you know, and at the same time, yes, you know, I have faith in God and stuff, but, you know, sometimes, like, yeah, well, let me put it like this. Like, yes, you know, we can have all the faith in the world and stuff and, you know, still have to be conscious of the medical side of it. And, you know, God performs miracles every day. And, you know, I do try to keep focus on that, but I also want to keep focus on the medical side of it, as well. So like I said, it'll always be one person that's more dedicated than the other person, and it's usually the woman that's more dedicated. So, you know, women are typically the more dedicated ones. We're the ones that's willing to make sacrifices, you know, to do whatever it needs to be done, whatever needs to be done, if we need to stop doing something, or if we need to do something more, whether it's exercise or whether it's taking medications at the specific time or going through the workup. Women typically are more driven to do that than men. So that can definitely cause friction in any relationship when you feel like you're the one that's putting in your all to make this happen, and the other person is just not willing to give up certain things, or not willing to put in as much time and dedication as you can. And it definitely puts a strain on things. So you definitely have to be willing to talk things through. In IVF, it doesn't take just one person unless you're using donor sperm or something like that. If it's something you guys are doing as a couple, you guys definitely need to both be in on it and be willing to sacrifice and to do whatever needs to be done to get the procedure and the workup done for IVF. And just infertility treatments, period. It's a very stressful process. So there needs to be an open line of communication, within the relationship. And, people have to be willing to talk about things. People have to be willing to make sacrifices to get things done. So, like I said, as long as both parties are willing, to make the sacrifices and get things done, it's going to be trials, tribulations, it's going to be stressors, it's going to be setbacks, and even though I said earlier, like, there's no room for setbacks, that's just my own personal feelings because I've been going through this for so long. So I'm just really at the point where it's like, okay, this is going to happen or it's not going to happen. Like, we're not going to keep going back and forth and having setbacks like this because I'm fully dedicated to this. I'm willing to give up whatever. I'm willing to do whatever I need to do to get this done. And some women eventually do get to that point. Even it could be vice versa. It could be, the man is like, okay, well, you're not doing what you're supposed to be doing, to get yourself healthy, or, you're not following by doctor's orders. You're not doing this and doing that, to make this achievable and stuff. So, it's not always the woman. It could be the man, be like, okay, well, I really want this to happen, and you're not doing what you're supposed to be doing. But, in just my experience, I've seen it's mostly it's mostly the woman that's really pushing for things. And stuff. Men have a little bit more patience for things, and they look at things totally different than what we do. And then a lot of times they don't always understand the medical side of it. So they think they can be just lackadaisical with stuff. Things can just be done whenever, and it's not that way. Everything is timed when you're doing stuff with like infertility treatments. So like I said, it's definitely going to be times, and even in my own personal experience, just even recently, it's going to be times where you feel like you're just going to want to completely give up. And I've felt that way plenty of times, even recently. Just like, what, I don't want to do this anymore. Like, I will adopt, be by myself and go adopt and do what I need to do, because I don't have time to keep playing games. So I just think at that point, you have to just relax, take a step back, pray, do whatever it is you do, and just really reevaluate, how you want to go about things. Like I said, it's a very stressful process. And then when you're dealing with all the different medications and stuff, and it leaves you not feeling like yourself, and you get tired of being tired all the time. You just get tired of all the hormonal changes and stuff. And then you're in a relationship and you feel like, man, I'm going through this all by myself, or I'm doing this all by myself. And, you're not putting it in the time and the effort that I am. You're not taking this as seriously as I am, and it just makes you feel like, okay, well, why even continue to do this? And, like I said, you just have to really put your faith in God. And, you know, I feel like that there's pain in the process. And I've been going through this a very long time. And there's been a lot of pain in this process, whether it's physical, mental, or emotional pain. And I do not believe that God makes mistakes in anything that he does. I believe people go through things for a reason. And, you know, even with myself, like I've always questioned God, like, okay, you know, why I can't be like other women that can conceive just at the drop of a dime? Like, why does it take so much for me to have a kid? And, you know, but when I get in those moments and I feel like I want to give up and I feel like, you know, enough is enough, I just want to get back to my normal life, I want to be normal, you know, I don't want to do this anymore. You know, I have to look back as like, okay, God trusted me with this process for a reason. And whether it's to be a testimony, you know, to someone, whether it's to help someone through this, or whether it's just for, you know, God to get the glory out of this and then cause somebody else to that didn't necessarily believe in God to believe in God through my process. So, you know, I just look at it in that way, like, okay, Keisha, don't give up. No matter what happens in the end, you might end up adopting. You might end up, you know, being by yourself and, you know, maybe using donor sperm or something like that. You know, it never, you know, this is not something that is set in stone. Like, it could go any way. You know, or you and your husband might end up getting pregnant naturally, or we might end up finishing the IVF process and, you know, it being successful. You know, you never know how the process will turn out. But either way, I just have to keep in mind that, you know, despite what it is, despite how I feel, despite how things might be going at the time, you know, at the end of the day, God gets the glory out of it. And if I can be a testimony and a help to someone that's going through this, then that's the mission at the end of the day. And I have to keep realizing that this is not about me. Like, yeah, in a way, it's about me and my body and me and my husband going through this process. But at the end result, this is to help someone else. So why would I give this up just because of, you know, something minor or something that could be fixed or something that could be talked out, or, you know, something that I might just need to take a break from and breathe and pray about it or whatever. You know, you should never let anyone or any situation, you know, deter you from what you know God has called you to do. And I know without a shadow of doubt that this whole process is supposed to be a testimony for someone else's life to help them get through this. So regardless of how the situation ends up, you know, I'm not going to give up. I'm going to be a mom eventually. And, you know, this is something that I'm passionate about speaking about. And this is something that I'm passionate about doing. So, you know, I'm not going to give that up for anyone. I'm not going to give that up for like any situation. Because then it's like, okay, the devil just won. Like, you know, he shut my mouth. Like, you know, so you definitely have to look at things in different aspects. And then, you know, if you and your significant other, you know, are just having a hard time getting through the whole infertility process, you know, there's counseling out there. There's nothing wrong with counseling. And men typically steer away from that. Like, oh, I'm not telling this person my personal business. And, you know, I'm not sitting on a couch or I'm not sitting on the phone talking about stuff like that. There's nothing wrong with it. God placed therapists and doctors on this earth for a reason. So even if you have to go by yourself, you know, just to get you some type of help and some type of clarity and some type of, you know, some type of thing to help you get through the whole situation, then do that. Because at the end of the day, we're women, and a lot of this is being placed on us. Our bodies are going through all of these changes. We're going through all these different emotions and stuff. So if you got to go by yourself to go get help, or you got to talk to somebody, or you got to cry, you got to pray, you got to meditate, whatever it is you do that. You know, just to keep your sanity. And like I said, that's why I'm doing this, because I've been going through this for, I want to say 3 or 4 years now. So it gets worse before it gets better. You know, it'll look like it's going there and we almost there, and then bam, we'll hit another stumbling block. So, you know, whatever the situation is or whatever, do not give up. Or whatever. God created women to reproduce. That is what we're supposed to do. Sometimes it's difficult for some of us, but that doesn't mean that it's impossible. So I just wanted to share some encouraging words, give you guys an update on stuff. I definitely will give you guys an update on how the HSG ultrasound went and what the next steps into moving into this whole process will be. So yeah, like, subscribe, share, get this out there, get more people watching it, and thank you for joining me with another YouTube video of Adventures in Fertility with Keisha, and you guys enjoy your week. All right, good night, bye.